Hello and welcome to the Ajyal Center's orientation. We've chosen to present the orientation in a video format to ensure we're taking all precautions necessary to ensure the safety of our students, parents, and staff here at the center. My name is Philip Tanner. I am the Executive Center Director here at ACCEL. For those of you I haven't had the opportunity to meet, I will start with a little information about my background. I earned a PhD in educational psychology, school psychology focus in May of 2006. Prior to this, I earned a master's degree in educational counseling. I've worked in education for over 20 years and have experience as a counselor, a coach, a school psychologist, and a special education director. I've also worked as a clinical professor at Northern Arizona University, primarily teaching graduate courses in educational psychology. We've opened the Ajyal Center in September of 2019 last year, and I'm excited to bring students back to campus here for our second year. We're all looking forward to bringing students back next Wednesday, October 14th. Students will be on campus 4 hours per day, 4 days per week. Days of attendance will be Sunday, Monday, Wednesday, and Thursday. The center will be thoroughly cleaned on Tuesdays and over the weekends to make sure that our students and staff are working in a very healthy environment. Our primary concern here at the center is to provide excellent educational and therapeutic service to our students in a safe environment designed to reduce the risk of COVID-19 infection for students, families, and staff here at the center. For this reason, the first presentation following my introduction will be from our two esteemed principals, Hiam Ganadili and Sultan Al-Amri. They will discuss the extensive safety precautions we are taking here at the center to prevent exposure to infection. After the safety presentation, our program manager, Nick Hodges, will be presenting you with a tour of the facility and providing important information related to our programming that begins next week. Our clinical director, Chris Hanadel, will be presenting information related to our therapeutic supports and services. Our vocational director, Kathy Roberts, will be presenting information related to our new vocational programming and supports. Finally, our two lead teachers, Jeff and Erica Nickel, will be conducting a presentation within one of our classrooms. This will conclude our presentations, and they will be presenting information related to the procedures in each of the classrooms and what you can expect for your kids when they arrive. Thank you for choosing ACCEL. We appreciate your trust in us, and we look forward to exceeding your expectations.
Hello and welcome everyone. In this presentation, we will discuss ACCEL International Return to Facilities Plan and how to return safely. Our priority here at ACCEL is the health and safety of our students, employees, and their families. We will explain how is our plan to reopen the center is effective and in line with the Ministry of Health and Education guidelines. At ACCEL, we will provide educational, therapeutic, vocational, and evaluation services to our students. We make sure that students are safe in every step of our program. We provided employees with COVID-19 awareness programs, and we also have posted COVID-19 signboards throughout the building to help our students and staff stay safe. All staff members are obligated to wear masks throughout the day at the center, and all staff will sterilize their hands and their tools before and after each use. Students will be divided into small groups and with 2 meters apart. Guide signs will be available all around campus to guide staff and students. Here at ACCEL, we encourage both students and staff to adapt good hygiene habits at work and at home because they are essential to prevent the spread of COVID-19. Halls will be cleaned before and after each group. The center will be closed on Tuesdays for thorough sterilization in addition to the continuous cleaning of the center on daily basis. Tables, chairs, and tools will be sanitized before and after each use. Each student will be assigned his or her own tool to use. Teachers will direct students to wash and sterilize their hands regularly. Students' meals will be homemade to avoid anyone touching them except family members. If a student needs help with eating a meal, one of our employees will help only after sterilizing his or her hands and using clean gloves. Hand sanitizers and wipes will be provided throughout our facilities. Key areas will be constantly sterilized, such as water faucets and door handles. It is of high importance that families follow our students' pick-up and drop-off policy to ensure the safety of our students. Parents must be present on their scheduled times in front of the center. There will be a colored card attached to the car to show the student's class. Students will have their temperature taken by an ACCEL employee at the door. Any student showing symptoms of flu or fever will not be allowed into the center. Students will only be accompanied by their class staff members. Students will be accompanied one by one when leaving to prevent gatherings. Students will not be allowed to attend any sessions in the center before number 1. Submitting a medical report signed by a doctor. Number 2. A consent form signed by a parent. As parents will have an essential role to play at this stage, the procedures below should be followed. Review disease guidelines and recognize its symptoms. Examine the child's medical condition regularly, as well as making sure he or she has no fever or any other COVID-19 symptoms. Do not give your child any fever-reducing medications before going to school. In the event of a high temperature or any of COVID-19 symptoms, the child should be kept at home and healthcare provider to be contacted. The school must be also contacted and notified. Students who have high fever will not be permitted to return to school before they are fully recovered. Students should have one clean mask and a full water bottle every day. Employees can come to the center only if they have no symptoms. If any employee shows any symptoms, he or she will not be allowed into the center until a negative COVID-19 result is provided. The healthcare provider will be consulted to determine the necessity of performing any other tests or undergoing home quarantine. The employee can return to the center if a written permit from the healthcare provider is presented. If parents notify the center of a student's illness, the center's nurse will follow up with the parents and check if there are any other COVID-19 symptoms. If the answer is yes, the nurse will inform the director of the center. We use staff tracking method in the center, which will be explained in a later video, to keep track of staff and students' movements. So, if we have any confirmed positive COVID-19 case, we will be able to track and isolate those who mixed up with that person, and they will be asked to stop coming to the center immediately. If your son or daughter is showing any of the following symptoms, please keep her or him at home. In case any student or employee was suspected of being infected with COVID-19, wear a protective mask immediately, follow appropriate sterilization procedures, as well as avoiding physical contact with others. Notify the nurse of the suspected case and notify the director of the center. Accompany him or her to the isolation room while wearing protective clothing. The nurse will diagnose the case using protective clothing. The nurse will communicate with the parents and give the necessary instructions based on the results of the evaluation. Parents will contact the center upon arrival, and the student will be accompanied on leaving by the parents. Parents or visitors are not allowed to enter the center facilities without an appointment. If you have an appointment, it's important to follow the below. Enter the school through the security room and present your ID card. Wear a mask. Check your temperature before entering the center. Do the check-in at the reception. Go directly to your appointment. Please leave the center immediately after the end of your meeting. Thank you for your cooperation. Stay safe and healthy.
Hi, my name is Nick Hodges and I'm the program manager over at the Young Men's School at the Ajyal Center. Terry Baldwin is the program manager here at the Ladies School. She isn't with us right now, but I want to give you guys a short and brief tour of the campus. Just know that the men's school and the female school looks very similar, but we'll just do a tour of this one right now. Behind me is our first set of developmental classrooms. So we have 4 in each hallway. And you'll see there's a lot of fun and decorations outside as well as inside of the rooms. We have a lot of different ages from preschool up until high school. Obviously this would be a little bit of a younger hallway. We have instruction in English and also in Arabic, so you'll see both presented throughout the campus. This is our second set of 4 classrooms. Just to remind you that each classroom is only going to have 4 students in it at a time. We will have shortened school days for 4 hours, and we're only going to school Sunday, Monday, Wednesday, and Thursday. This is our observation room used by our clinical team. Usually a psychologist, an OT, or a speech therapist is using this. We use this for initial assessments with our students. So after and while they're getting enrolled, they'll come in here with a therapist, and this is an awesome chance for our parents to be able to come into here and observe their student, their child, during this assessment. Obviously this would be a 2-way mirror, so our students can't see that the mom and dad are watching them. But we have a nice view of the entire assessment. This is our teacher workroom. They can come in here to use the computer to make materials, to find stuff for their classrooms, curriculum, and work on their classrooms. Over here, we have our library. A lot of time and effort has gone into this, and you will find a lot of books for our students. Most of them are in Arabic, but we also do have English versions. We have group in here as often as we can, so our librarian will pull out book activities. Some are adapted, and students will sit, obviously spaced apart, and have a reading session. Here you will find the physical therapy or the physio room. This is for our physical therapists to work with their students one-on-one. So if your student does receive the physical therapy services, they'll be done in here. You'll see all of their professional equipment behind me. The physical therapists also work on a lot of gross motor, and they do that here in the gym. So you'll see we have a large multi-purpose room for activities. Physical therapy. And lastly, I'll show you the sports hall over here. This is also used by our clinical team. You can see it is for climbing, for swinging, for sliding, and other sports-related activities. Right here you'll see our dining room or cafeteria. Students can come in here to eat lunch, but we won't be using it during the COVID-19 pandemic, so this will be closed. And just remember that we will not be providing lunch this semester until it's safe to do so again. So if your student needs snacks, please send them along with them. Over here you'll see our sensory hallway. We have our white room, which is very bright and stimulating for students. Then we have our dark room, which is very dark and has some colorful lights, and we are installing a bubble tube. And then lastly, we have our soft room, which is full of soft items that the student will want to bounce around for a little while. So I've mentioned adaptation a few times, and I just want to show you that we've taken a typical book that may be a little difficult for our students to read, and we've adapted it to make it more functional for them. We've highlighted words, we've given them answer pictures so that they can follow along with stories. This is where we make all of that stuff. It's the adaptation room, and our adaptation specialist helps us out. We also have small tasks like this for students who are working on sorting and matching. And this is where a lot of stuff gets created and made for our center and our students.
Jeffrey Nickel, I am the special education lead for the male building. I just want to go over a few things that will be going on in our classrooms related to safety precautions in the coronavirus. First thing I want to point out is that outside of every room that is being used, we have a specific QR code. This allows us to trace which staff have been in which rooms and in contact with which students, so that in the unlikely event or unfortunate event that there is a positive case, we have the history of which staff have been with which students. So let's go take a look at the classroom.
Hi everyone, my name is Erica Nickel. I am the special ed lead here at ACCEL for the female campus. I wanted to show you the inside of our classroom and a little bit about what to expect when your child comes to school. So as you can see, we have markers on the floor to show students where to line up. Every student has a schedule which corresponds to the stations that they will be at. We have a station here, over here, an independent station, and also a room for one-to-one activities. The layout of the room allows 4 students to be spaced 2 meters apart and allows that individualized attention that the students will benefit from with the teachers and paraprofessionals. Every hour, materials will be cleaned. After a student uses materials, they go into a finished bin to remind the staff that that is dirty and will be cleaned. This is our classroom. We're so excited to have you. Thank you.
So the students will be on campus for 4 hours. During that time, they will receive academic specials and therapy services. As far as their academic time, they will be utilizing a variety of curriculum that is adapted to fit their unique needs. We cover areas such as reading, writing, math, social studies, science. They will also be receiving individualized education plans, which are unique learning goals for each student that will also be addressed in the classroom with their teachers and paraprofessional staff. Therapies and specials will also be taking place. Just to let you know, all the therapies that we have offered here at ACCEL, these include speech therapy, occupational therapy, physical therapy, and ABA therapy. These therapists will be integrating into classrooms. They will be working with students one-to-one, in small groups, no more than 4. They can also pull students into rooms such as this one. This is an example of a therapy room. It's for occupational therapy. Kids can come in here to get a sensory break or for sensory integration needs. Speech will also have a room that they can pull them into. Physical therapy can utilize the gym and other areas of the campus for their needs. So, take a look around. We got some fun stuff. Please make sure that during drop-off and pickup you are on time. This will be important for all of our parents and students. During drop-off and pickup, please wait for a staff to come out and bring your child into the building or bring them back to you. During this time, students will be receiving a temperature check before they come into the building. Please follow government guidelines to ensure social distancing safety as much as possible. And of course,
Always wear a mask.
thank you.
Thank you.
And welcome. My name is Chris, and I'm the Clinical Director here at ACCEL. I want to take a few moments to provide you with some information about our therapeutic supports and services here at the Ajyal Center. Our talented team who provide our students with classroom therapy integration treatment include board-certified behavior analysts, occupational therapists, physical therapists, school psychologists, and speech pathologists. For those unfamiliar with classroom therapy integration treatment, it is the treatment of students who perform the same or similar activities supervised by a therapist with the classroom team's collaborative support in order to meet the students' goals. This form of therapy is an increasingly popular format thanks to its research showing its benefits. Some of these benefits include activity tolerance, communication, peer modeling, and self-esteem. Here at the Ajyal Center, our therapeutic supports team participates in a collaborative effort with each classroom. This approach allows us to provide purposeful, planned, and impactful treatment approaches that are meaningful and beneficial for our students. Thank you for allowing our team to be a part of your students' growth here at ACCEL.
My name is Kathy Roberts, and I'm the new vocational director here at ACCEL. I'm the director on both the girls' side and the boys' side. I've come from Arizona in the USA. I have over 25 years of experience, and I feel very fortunate to be here and to be able to work with your kids. There's 3 sections for ADL, for the vocational program. We are in the ADL room here, where we're going to be doing ADL means activities of daily living, and they're skills that are going to help increase independence. And every child at this school will receive 30 minutes a week of ADL instruction in this room. So this is our kitchen room, where we have our kitchen table. This is where we're gonna learn to prepare simple snacks. I'll come around this way. I'm gonna bring you into the next area, which is the bedroom area. And here, kids are gonna learn different activities about sorting clothes, hanging clothes up, learning how to button, zip, those kind of ADL activities. And then in here is our bathroom. And as you can see, there's visual sequences. We learn different tasks like washing your hands, brushing your teeth, combing your hair, all those kind of ADL tasks of taking care of your body. Okay, and the other 2 areas are, we have pre-vocational, and that's for our students that are 13 to 15 years old, and they will be coming to pre-vocational in addition to the ADL. But pre-vocational will be daily. They will get 30 minutes daily, 30 minutes to an hour daily of pre-vocational skills. That's where we work on job readiness skills, such as sequencing a task, using fine motor skills to work on a task, increasing those fine motor skills, increasing endurance and following directions. They'll also be helping to run our snack cart and helping to make popcorn on the girls' side. And on the boys' side, they'll be helping to run a school store for our pre-vocational program. Our vocational program is our job readiness program. We have on the girls' side, we have a cookie making business and doing bakery stuff. We have a clerical business, and we also have, we're doing cookies, clerical, and then on the boys' side, we're making pizza, and we have a wood shop. Let me just show you our vocational room. And I just wanted to let you know that we are practicing our safety here. In our rooms, we're gonna have no more than 4 students per room in the ADL room, pre-vocational room, and vocational room, practicing social distancing. So they will be scheduled 4 at a time. and all materials will be thoroughly cleaned between each group. So looking forward to having your kids come to school and being able to work with them. Thank you.